Has anybody ever said to you, hey, I think you need some counseling, or you might want to go into therapy for that? It's a common response that we get when people see that we're needing help with something. However, I find that people use those phrases interchangeably, and they're really not the same. It's just something people throw out with good intention, but when you understand the meaning of it, you're more likely to get help and get the resolve you're looking for. My name's Dawn. I'm the recovery lady. I'm a licensed behavioral health clinician, and we're just going to talk today briefly about the difference between counseling and therapy. Counseling first. Counseling is something that usually is for immediate behavioral change that's needed. Something like a current addiction, maybe bereavement, grief, loss of a loved one, feeling overwhelmed because you've lost a job, got a new job, your kids have moved out of the house. It's something immediate and that's on the surface. It's shorter term than going into therapy, and it's solution oriented. I'm a counselor. I'm a behavioral health clinician, and I'm a counselor. In practice, I like to meet you where you're at. We use some cognitive behavioral therapy, a lot of behavioral implementation, and move you forward with healthy coping techniques. Counseling, people will often compare it to coaching, and I want to be really clear, and it's nothing against coaching. There are wonderful life coaches. Anybody can be a life coach or a coach online in 6 weeks, for some of it 6 months, and get certified. And the thing that I really want to emphasize, whether you're getting counseling or training or coaching, is make sure that you are going with a licensed, credentialed person through a government acknowledged board for licensing. Because at the end of the day, this is your mental and behavioral health. So I really want to throw that in there, not just, oh, my friend's a life coach. Okay, tell me more about it. Because within the realm of counseling or therapy, you can definitely get some coaching. So let's recap first on counseling. We have short-term, more of a single issue, immediate behavioral changes to help you move forward from an area that you're stuck in, like grief, addiction, loneliness, those types of things. And we will just meet you where you're at. And if you don't have a big trauma past, it's often very appropriate. And even if you do, there's still times that counseling is really appropriate to help you move forward. Maybe not getting along with people in the workplace. There's all types of immediate behavioral changes we can get for issues on the surface. Now let's talk about therapy a little bit. Therapy, where counseling is more immediately forward driven, goes backwards. In therapy, the therapist is looking at your history, your time tunneling. You're looking into past abuse, past trauma, mental health diagnoses. Do you have PTSD, anxiety, bipolar, or more? OCD? Were you raised by somebody with a personality disorder, and now you're suffering the results of that you don't recognize? That is not a quick behavioral change. That from a surface issue, that's going to help you move forward. Therapy requires you to go back and see how your current behaviors were formed and affected by past issues and how you've carried that forward. And it's critical to go back and look at that and to say, wow, this did happen in my house. And wow, maybe my person who raised me did have this issue. And how did that affect me? Because you're not responsible for the fact if you were exposed to things or even if you have a mental health diagnosis. But you're responsible to take care of it, and it takes long work. A lot of good therapists can do very, very effective counseling as well to help you move forward. But there, in my professional opinion, are times for those things to be separate. You don't want to go into counseling if you're dealing with a trauma past. You want to make sure you have a therapist that's licensed and specializes in trauma. If you're going to get counseling and you need to be with a licensed behavioral health person, you want to make sure that you're getting somebody that just isn't a life coach. And a life coach can be great. Hey, I need to define where I need to be working and what I need to be doing. But when you're trusting your psyche with someone, it's so critical that you know the difference. So, key thing for counseling, that's an immediate change with immediate behaviors for a surface issue. Therapy, you've got stuff in the past you haven't dealt with that's affecting how you deal with things today, and you need longer term treatment, or you have a mental health issue that a therapist can diagnose and help treat. Not difficult, but essential to know the difference. I hope that helped. If you haven't liked, shared, and subscribed, please subscribe, share, and like. I'm trying to build this channel to make a difference with these nuggets. Thank you for joining me. I'm Dawn, the recovery lady, a behavioral health clinician. Love you guys. Bye.